This is Dr. Latasha McElwain. I am giving a little snippet today on my course at Grand Canyon University. This is the case management and crisis intervention skills for addiction and substance use. And question one on week one, the question is to describe some of the key responsibilities of counselors slash case managers working with co-occurring disorders and substance use addiction that a case manager should know how to do. Second question, second part to that is what kinds of addiction and substance use disorder resources would they find for the client? And then the last one is why is utilizing these resources important? So I'm just going to give an overview based on personal experience, which is what I typically do with all of my discussion questions for my courses, just to give students an understanding of, what kind of answers we're looking for. Although they're going to find some good information in the resources in the books, in the textbooks that we have, you're also going to find some good resources based on if any of you are in the field or know someone in the field that you can speak with in regards to substance use disorder case management and the things that they do pretty much on a daily basis. So for this recording, I am just going to let you guys know that this first question will be answered again based on personal information, personal experience of mine. And I'll talk about some personal experience probably of some coworkers that have worked with me before and told me some of the things that they've done. So in the case management realm, counseling case management realm, working with individuals with co-occurring disorders and substances and addiction, typically a case manager will know how to do the basic level of case management that we typically do. And the basic level of case management is interviewing your client. A lot of times you may have a needs assessment. You may also have a clinical assessment. In my state, we still do clinical assessments on individuals. So we get a full clinical assessment, a full clinical diagnostic, maybe information from their psychiatrist, information from previous therapists, previous service providers. We gather that information as case managers. So we are gathering information. We are trying to help this individual with case management. Sometimes we are looked to as the counselor. We're also looked to as the consultant. We're just looked to as that person that's going to pretty much kind of coordinate everything and keep everything together, along with, again, sometimes doing some counseling and sometimes doing a heavy load of case management, heavy load of counseling with the individual, therapy with the individual, guidance, support, all that good stuff, empowerment. But one of the big things that we do is try to make sure we try to coordinate for our patients. So we try to make sure that we're putting everyone that need to be at the table for treatment team meetings and things of that nature, making sure everyone is providing the most adequate level of care for the person, not only the most adequate level of care, but where that person is feeling like we are caring about them. Because of course, in my state, and I think in most states, they're going to a holistic person approach. And with going to the holistic person approach, we're looking at everything from head to toe, the environment and everything for our patients and our clients to make sure that they're able to be able to access things, be able to get the help that they need and the services they need. So, with that being said, what should a case manager know? A case manager should know how to, again, gain access to everyone that's working with the individual, to be able to bring everyone to the table, or at least be able to have individual meetings with some of the ones that wouldn't be able to make a treatment team meeting, or if they have representatives that can come to the treatment team meeting, be able to have that information from them on standbys, because that's also a big thing to have, is knowing kind of what's happening if there's a speech therapist, or knowing what's happening if there's a probation officer, or knowing what's happening in the event that those individuals can't be there, knowing what's happening if it's a medical doctor and they want to send their reports in. So it's a lot of compiling a lot of information together. And then it's a lot of, again, communication back and forth with professionals, being able to do that. And then we also run into a realm of, again, like I said, providing some therapeutic counseling. Most of us are licensed professionals in my state. So most of us are providing some, clinical, more than just clinical, knowing, different types of things. We're also able to provide a light bit of therapy if we're able to, or, that support, that encouragement, everything that individual needs. And if we're able to provide that light level therapy just to kind of keep them going, we're also able to make those referrals out for additional services as we need to. So those are some big things to know. Of course, our report keeping, keeping up with all the reports that we need to have, and being able to present those reports in those meetings, holding those meetings together as far as collaborating and making sure that we are servicing the consumer, patient, client at whatever level they need to be serviced, and that their needs are put first, because we do try to allow them to, have it very client centered, or part patient driven services, client centered services, different things of that nature. But we also have to make sure that we're doing the best for a patient as well, or a client, or a consumer. But the biggest thing is when we're talking about what kinds of addiction and substance use disorder resources we would find for the client. So that would be in my state, it's a wide range. So in my state, yes, I need to be looking for housing. I need to be looking for how they're getting back and forth to the grocery store. Are they using Uber? Are they using a taxi? Are they using the city bus? Are they using the train? I mean, it's a lot of different things like that. We go into, oh, he has a knot on his foot. How do we get him to the foot doctor to get that taken care of? You know what I mean? If he has issues with his eye, like I said, we're going to that whole person approach. And that whole person approach means that we are looking at everything on an individual. Oh, his hip is hurting. Let's get into an orthopedic doctor. All those things. He's got a little sniffly. Okay, let's make sure he has and this is a big one. We make sure everyone has a primary care doctor regardless. So we try to connect them with primary care doctors so they'll have those individuals in place. So we're always looking at everything with the person. We're trying to figure out how they're getting groceries from the store. We're trying to figure out how to help them budget to make sure that they can pay their light bill, and make sure they can pay, this, that, and the other. So it's a lot of different things that we do as case managers. And again, I'm speaking from a case management role in our Medicaid systems. I've been a care coordinator in several different agencies and done several different things in that capacity. So that's kind of my experience. Like I said, it's whole body, whole person approach. I mean, we are going from the teeth, getting them a dentist appointment, to getting the root canal pulled, all the way to getting the ingrown toenail taken out. Or, I mean, like I said, we go deep, and we do a lot. We are helping them sometimes with natural supports, meaning if mom's involved, if dad's involved, if someone's not involved, if, helping them reach out to different family members and try to be a support and a guide or a bridge if we can. Because a lot of them have killed relationships with their family members. Their family members' relationships, it sucks, and it's hard to say that, but that's what happens when you are working with an individual that has addiction or substance use disorders, and have had a long history of ups and downs with their family members. But we try to bridge the gap and try to work with families and work with significant others and things of that nature. Children, yeah, we get a lot of older individuals, and we're trying to work with their kids to not necessarily all the time say, oh, you got to take care of your parent, but how can you support in your parent being able to take care of themselves? No, you don't have to be there every day or whatever, but you at least checking on them once or twice a week, maybe. So that's what we ask some of our natural supports, especially the children sometimes that are in the area or whatever the case may be. Now, if there's a triggering situation, we try to move past that, or try to recommend them out for family therapy or things like that. So we do hit a lot of different resources. I'm gonna say that again, a lot of different resources, even resources as far as the food bank. If they run low on groceries, they don't have enough food, making sure they got food stamps in place. A lot of them do have food stamps in place. Making sure ones that need to be connected with Medicaid, Social Security Administration, and things of that nature, that we're trying VA services, getting them to the right services they need to be with. They might need to be with VA, getting a particular service versus out in the rest, in the world with regular civilians. They need to be in VA housing or something of that nature. So it's a lot of ups and downs and different things that we figure out. And then also
when they're in VA services, we also have to see if they, especially if they're dealing with a disability on our end as a civilian, we have to figure out if that's a disability that was a part of the VA, the military when they were in the military, and then that kicks it back to them possibly being eligible for a percentage of their veteran benefits. So there's a lot there. There's a lot to uncover, but that's what we do as case managers. We are kind of like big investigators. We are checking for everything to try to support our consumers the best way we know how. All right, so that's a good bit about the resources. And then I did mention I threw out there probation officer. So some of our individuals are offenders too. Some of our individuals are dealing with legal systems and dealing with different types of entities. So we have to, make friends with all those different agencies. If we have a someone that's a repeat offender at the hospital, that not a repeat offender, but a repeat frequent flyer at the hospital, that's one of the things we have to get, try to make sure we are aware of, that the hospital is making contact with us and we're making contact when we find the person is in the hospital. Because with me doing Medicaid, I was one of the first ones alert because we're the insurance. So we were first alert that the person had hit the emergency room. And then if they have a probation officer or a parole officer, we have to work with those individuals as well, creating those relationships. There's a lot about creating relationships and things like that. So you get known for doing certain things and being present for meetings and things like that. So you do get known for those things and able to build those relationships in order to help others as they come along. The last question I see here is why utilizing these resources are important. And I guess I'm giving you that as well. Why it's important to utilize those resources. Again, it's important for the client to utilize those resources because they need to, be aware of what's out there for them and what services can help them. I mean, you can find all kind of different things in the community. I'll share this. I kind of case manage for my sons. They're adult sons, and they have special needs. So I work around the clock finding different things for them to be involved in, especially as they have moving into their adult life and things that they like to do or things that they don't want to do for the most part. One of the things that I was able to find in my city was a food service where an individual can be a what they call a volunteer and go and help them make food trays for adults and for the Meals on Wheels and things like that. And then later on, I came across another program that, of course, is a nonprofit, just like the first one I just mentioned. There's a culinary school that's a nonprofit organization that's 14 weeks long that one of my sons have committed to going to and will start soon. But that's something that we look for our clients also. We look out there to see what's available to them. I mean, I tell people all the time, kind of being like kind of that case manager overseer for my sons. I do enjoy what I do and I love helping them. But I also tell individuals when I find something like that, that is something I'm going to use again. I mean, when I am in those situations where I'm working with individuals who are on the side of employment, occupation, and things like that, and they're looking for something different, that's a big resource. I mean, that they can go to a 14-week culinary program and see if they like it and see if it's something they want to get their foot wet in. If they like it, they like it. If they don't, okay. But it is a nonprofit program that will take them through some typical entry level stuff to see if they are interested, and then put them through the program. When they graduate their certificate that says that they have went through a culinary school, and voila. But I say that to say there are just a lot of different things out there that can be done that you can look for and things like that. You can find physical activity programs. You can find gyms and things like that, and you can get them at special rates for your individuals that are disabled or that are low income or things like that. So it's a lot of different things. For not only the client, patient, or consumer to use the resources, I think it's also important for us as the care managers to use the resources also, or be able to use those resources as far as being able to have our other clients go and our next set of clients go and our next somebody else is interested or whatever the case may be. It's almost like if you were a I say this, but I'm going to say if you were a
high school counselor, you will be talking to many students, but you will be talking to them about going to this college, going to that college, and you got a relationship over at that school, you got a relationship over at that school, and you're gonna get them connected with this person, get them connected with that person. It's kind of the same thing, with more detail, of course. But as a case manager, that's what you're doing. You're building relationships. That's a big part of your job, is building those relationships and being able to support people and support your clients and consumers, patients, to move into different areas that they're interested in, and making sure that they can be pretty much either successful or realize that that's not for them, because sometimes everything's not for everyone. So I like to be an open-minded case manager, counselor, case manager, on when we say that, because a lot of times you never know. And again, when we say occurring disorders and substance use, they can have a lot of stuff going on that may not make them suitable, and that's something that we also screen for as well, to make sure that our client is suitable, or our patient consumer is suitable for wherever we're sending them. I can't send someone that has really bad paranoia probably into a group therapy setting. That's not going to work. And being clinical, me as a case manager, I would know that. Yeah. But a lot of times those are the things that we make sure that we are tapping in on. And in my state, if you are a counselor, case manager in substance abuse, then you are both. You are the counselor and you are the case manager. So you do both. I mean, we do it, and this is before we came into the whole person episode, of trying to work with the whole person from that scope. We were always the care manager, case manager / substance use, because chances are, if they got a case manager or care manager from the LME, which is the MCO, and all that's kind of the terms dealing with Medicaid services in my state, if they had one of those persons, they probably a social worker and they got a substance abuse background. So when they came to me and I'm sitting in the agency and I'm working for the agency doing case management and doing counseling, then my care manager or care coordinator with Medicaid is talking to me about blah 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 blah, and I'm talking about substance abuse, and that social worker has no idea what substance abuse is all about. Or it could be also that counselor that is not linked with substance abuse, they're just the LPC or LCMHC, then they don't have that much of a background with substance abuse. They don't know what I'm talking about. So I chose to, of course, be substance abuse and mental health. I do domestic violence also. So I'm definitely a person that is in your home, that could be in your home and could be doing stuff. I started out doing a lot of in-home type therapy. So a lot of times I was in your home. I love some of the programs that I've worked for, because we were able to go into homes and see that the home is messy, and we can have a care person come in, like a personal care team come in and help that person keep their house clean. We could have a person, if they are able to get certain things, now that we're to the whole person uh, portion of what we're doing with Medicaid. Now, there are things sometimes I think we can get personal care, we can get nursing care, which helps them with light meals and different things like that around the home. So there's a lot of different things that we're able to jump into, which makes it nicer, trying to go into someone's home and trying to make sure that they are adequate at home, and making sure that there are no, bad behaviors going on as far as domestic violence, or if they have been involved in domestic violence, chances are some of them do pick up with another person that might, be violent towards them again. So, we try to, intervene and help as much as we can. But again, we're not making decisions for people. We're helping them with whatever it is they want to do. Again, like I said earlier, it could be something that is appropriate. They're just not a good fit for it. Or it could be something very appropriate. They just don't have the right behaviors and actions for it. Or it could be something very inappropriate that they may want to do. But a lot of times, depending on, where you are and what's going on, it's a trial and error. If they feel like they can do something and they go out there and do it and they don't make it through it, then it's not the end of the world. There are more options. So that's one of the biggest reasons why we're here and we do what we do as far as case management. And we also make sure that we are supporting them as that counselor, case manager, and that we're, helping them still feel good about the fact that they gave it a try. It didn't work, but we got something else you can work on. So that's the whole synopsis when we're talking about case management and crisis intervention.
skills for addiction and substance use. And again, the responsibilities of a case manager, care manager, counselor is a lot. Now, one of the things that has been a back and forth, and I came out of case management counseling and then went back into just the case management piece of it. But I think transporting patients in your vehicle, I thought that was something we got away from in North Carolina until about, a little while ago. I was working with an agency that demanded that I transported someone. And I was like, no, 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 that's not how this goes. So I had to help them and set them straight that that wasn't what was going to happen. And I actually just ended up walking away because that I thought that was very inappropriate. So with that being said, yeah, that's some of the things, but some states and some counties and some insurance and different things of that nature do allow you to transport patients back and forth. A lot of times, like I tell people, if some of the patients are living in some of the housing that we have to go in and deal with them, and bed bugs and different things of that nature. There's a lot, going on with transporting patients, and I don't have a car separate from. I could have a car separate from transporting patients, but that's not how I work. It's like if the agency allows me one, then I'll transport in their vehicle. But most of the time, I'm out in one of my vehicles. And with that being said, I'm not going to be, putting my precious cargo on board with bed bugs after I've already transported a patient for work. So, yeah, that's the kind of the things that you have to consider and think about. So, with that being said, that's discussion question one. I hope that was some good little tidbits for everyone. And if there's anything that you need, of course, you can always reach out to me via email and through the student portal at Grand Canyon University. And again, this is our course PCN 255 0500. Again, that's PCN 255 0500. Case management and crisis intervention skills for addiction and substance use. Thank you. See you next time.